What's going on, everyone? This is Victor. We're going to go through our clinical and ride time presentation PowerPoint. If you were in lab, you would have gotten this already, but feel free to reference this at any time. All right. Please submit your immunization records if you have not yet done so to my email, vchan@chicagoemttraining.com. That includes hepatitis B, MMR, varicella, Tdap, as well as a recent TB test. Some of you have not submitted that and just your records. So please get your TB test. What kind of test is up to you? That could be a PPD skin test, but you have to go back a second time to get your skin read, or a quantiferon blood test. Up to you. Once you've submitted these things, I will share with you a Google Excel file where you can start signing up. And at the very top, you'll see locations and times. And on the left-hand side, you'll see the dates. You need to sign up with at least 1 to 2 weeks notice because I send a weekly list every Friday morning. All right. So if your name isn't on that list for the following week, they're not expecting you. Right. So give yourself about 2 weeks notice when signing up for a future rotation. The objectives for your rotations. We want to provide an opportunity for you to practice the knowledge that you've been gaining with Marty, as well as the skills that you've been working on each other and on the mannequins in here in lab. You're going to, by the end of the class, develop some level of confidence in your patient care, as well as something that we call bedside manner, which is a combination of confidence and compassion and competence towards patients that are sick, maybe even experiencing the worst day of their life. You're going to be partnered with a preceptor in the ER. It's probably going to be an ER tech. On the ambulance, it's going to be an EMT or a paramedic. And you're going to experience EMS firsthand. You're going to, observe a lot of things, practice a lot of things, and probably learn a lot of tips of the trade. The 3 hospitals that we work with are Northwestern, St. Anthony's, and Insight. At the moment, we can't allow you to go anywhere else due to insurance and liability issues. At each of these locations, you'll be performing an 8-hour rotation, which is typical of a shift for a tech or a nurse. Sometimes they do 12-hour shifts and whatnot, but for us, it's 8-hour shifts because that allows you to do and pick first shift, second shift, or third shift. So we're trying to be accommodating to your schedule. Please do not bring your phones, right? You're not supposed to be taking notes on your phones or anything like that. So I know it can feel slow at times, but bring your phones. Just don't be on your phones. That was a major complaint in previous semesters by one of our EMS coordinators. And Tiff actually wanted me to share her cell phone number with you. And when you arrived at Insight, I want you to text Tiff upon your arrival to let her know that you've arrived, so she can pair you up with an appropriate preceptor. Whereas at Northwestern and St. Anthony's, you're going to enter through the ambulatory entrance, which is where you would take yourself or a family member if you were going to the ER. It just means able to walk. And you're going to be greeted by security, and you're going to tell security that you're there to do an EMS, ER clinical, and you're looking for the charge nurse. Once you find the charge nurse, reintroduce yourself, and hopefully they pair you up with a preceptor. If it's in the middle of shift change, which is, one shift giving report to an oncoming shift, so there's a smooth transition, then they might set you aside at a table or break room. If it's been 25 minutes, they probably forgot about you. So you got to go out there, be proactive, and let them know that you still need a preceptor, right? You should not be stuck in one area of the ER for all 8 hours. So specifically, you shouldn't be in triage for all 8 hours. I think there's a lot of value in observing and being in triage for a little bit, but at the end of the day, your objectives, like you need to write complete patient care reports. And if you're unable to follow 3 patients' journey throughout their ER, whether they're getting X-rays, EKGs, blood draws, interventions, and you're stuck in triage, you're not going to be able to write a thorough PCR. So, let someone know if you feel like you're being stuck in triage that you got to go hit these objectives, right? Here are the addresses. I have a whole note sheet with addresses and phone numbers and point of contacts that we'll be sharing. But Northwestern is downtown. They have several locations. We just go to the one downtown, River North. From UIC, you can take the 157 bus or the 60. And then there's buses that shoot up and down Lakeshore Drive from like Andersonville, Edgewater, as well as South Shore or Jackson Park, and go to Northwestern as well. I just don't recommend driving because even if you get to validate the parking pass, if you hit over 8 hours, your pays, your cost is going to be $40 still. So if you are familiar with the app Spot Hero, which is something that we use when we go downtown and we need to park, you can reserve a parking spot. Hopefully you can find a good deal on Spot Hero. St. Anthony is a mile west of here, our Pilsen location. So St. Anthony's is at 19th in California, in the little village area. And then Insight is in the Bronzeville area. It used to be called Mercy Hospital, close to McCormick Place. Yeah. Here are the companies that we perform ride-alongs with. It's not all inclusive. We currently work with Lifeline Ambulance as well, but MedX, Elite, ATI Superior. And we do welcome you do ride-alongs at your local fire department, especially if you're coming from the suburbs or have access to the suburbs. Highly recommend that if you have an interest in the fire service, getting on a fire department, becoming a firefighter, or going to paramedic school, or if you had any curiosity as to how your local fire department operated, this is your opportunity to do that. So I would go in person in uniform, tell them if you live in town, if that's the case, and say you're an active EMT student and you're looking to do an 8-hour observational ride-along. 9 times out of 10, they'll oblige. Sometimes they just need a letter of rec or letter of confirmation that you're an EMT student from me. Happy to do that, right? Please bring a government ID because these private ambulance companies will need to make a copy of your ID as well as a signature from you stating that you won't sue them if you get hurt. So you're signing a liability waiver, right? If you're feeling any anxiety at this point, it's understandable. The game plan, a good game plan, is to start your clinical rotations on an ambulance rather than in the ER, because you're with 2 preceptors for all shift, 8 or 12 hours, whatever it is, and you have 1 patient at a time. Rather than in the ER, you have multiple levels of providers, whether they're techs of all kinds, CT, ultrasound, X-ray, ER techs, nurses, physicians, PAs, all different kinds of providers. And then you have dozens upon dozens of patients to choose from. So it's more overwhelming than on the ambulance. So that's a good game plan if you are feeling any anxiety about it. We are trying to migrate our paperwork into an online platform, but there are going to be 2 pieces of paperwork that you will need to print out and bring with you because your preceptors do need to sign this stuff. Starting with something called the clinical evaluation, you're going to complete the top half. So you're going to identify the location, the department, your preceptors' names, the time that you were in and out, and then you're going to summarize the 3 patients you have by their age, gender, and chief complaint or field impression. And then the bottom half of the first page is the beginning of your preceptor's evaluation of you. So they're evaluating you on things like appearance and attendance and competence and skills and things like that. And at the very bottom of the backside, they're going to provide a signature. Now, if you don't check in with your preceptor periodically throughout your 8-hour shift, why would they sign your paperwork? There's no report. So check in with your preceptor or preceptors periodically so they become familiar with you and they can help you out along the way as well as provide that signature at the very end. I will include this paper copy of a PCR, but you are submitting everything online, an ePCR, right? This is your evaluation of your preceptor. I want to know the good. I want to know the bad. 9 out of 10 times, it's great. I enjoy sharing the positive feedback with our partners. And if it's negative, I enjoy sharing that as I don't enjoy it, but I think the clinical partners want to know how to correct something if it was a negative experience. Something that we've been trying to implement within the last couple semesters and moving forward is something called a clinical objectives checklist. To clarify, you need 1 of these for all 5 clinical rotations. You don't need a brand new one for everyone. And your score, your grade on this will be on a completion basis. So the first 5 rows pertain to a type of patient. So you're looking for cardiac patients, respiratory patients, neurological, abdominal, trauma. And then the last 3 things are you're administering some level of oxygen, whether that's via nebulizer, non-rebreather, nasal cannula, CPAP, and then medication. And this is kind of dependent on where you're at in class. Aspirin, nitro, oxygen is technically a medication, oral glucose, Narcan, stuff like that. And then the last one is it can only be done on an ambulance, but you're hopping on the radio and you're clicking the button down and you're relaying a message, something as simple as, hey, dispatch unit 402, we're en route to such and such hospital. That's it. It's a 10-second message. I just want you to feel what it's like to press the button and relay a message. Something that is new for you guys is the column second from the right called differential diagnosis. You are coming up with 3 potential diagnoses for your patient complaining of a specific set of signs and symptoms and chief complaints. So in a respiratory patient, is your respiratory patient, could they potentially be diagnosed with emphysema, CHF exacerbation, asthma, or a viral illness, like a respiratory viral illness? Like, what is it? So it gets your brains primed, right? And your preceptor, if you look all the way to the very right column, will need to initial these things, right? Just one. As far as uniform goes, at the moment, we are allowing the light gray previous polos, but we are phasing those out. And we do want you to be in the gray dark ones that say EMT student and our logo. You're going to need navy blue or black pants. They must be Dickies or Dockers or work style pants. No scrubs, no leggings, no jeans. Wear a belt. Your shirt should be tucked in. Facial hair is allowed. Just be aware that if you have to wear an N95, which in the ER you're probably going to, you need a good seal, and you don't have a good seal if you have facial hair. So a mustache is fine, but a beard, goatee, you're not going to have a good seal with that. So be mindful of that. As far as like utilizing the N95, so like in the ER, when your patient comes in with respiratory distress, it's unconfirmed whether or not they have COVID. So you're probably going to wear an N95 throughout the day, and you're going to wear a surgical mask on top of that. And so typical procedure when you're about to see a patient is to pump in and then eventually pump out. What does that mean? You pump in with hand sanitizer, sanitize, do your assessment, do your intervention, and then, sorry, and we forgot to put gloves on, do your assessment. You're done, remove your gloves in the room, and then sanitize, and then you're pumping out. And then remove your surgical mask, throw that away, and then beneath that, your N95 is still clean. You're good to go for the next one. All right. You have 1 week to submit your paperwork via the online format. Shouldn't be that hard because especially on the ambulance, we need to leave a copy with the receiving facility, right? So if you're following along with your preceptors, you should be able to complete these with them. But imagine if all of you, all 80 at the moment of you, submitted all 5, and each of the rotations has 3 PCRs, paperwork to us on the last day of class. We would never finish finalizing your grades. Be mindful about your preceptors and the time that they're giving with you. An ideal preceptor, if you had any one of our instructors in class, would, beyond introductions, would give you a tour of the space, whether that's the ER or the ED. I would ask where you're at in class so I can manage expectations as far as how much you know or don't know. And I'm going to quiz you, right? And then be inclusive, because as a student, I remember being excluded. And what does that mean? Well, if I'm wiping a bed down, applying EKG electrodes on the chest, moving a patient around, I'm going to call you over. I'm going to say, hey, can you help me wipe this bed down? Hey, move this patient with me. Hey, let's go to CT together. Hey, help me apply these electrodes on the chest. And I want to include you on things. And then if something interesting came in, I'm going to look for you. And if I can't find you, I'm going to page you on the overhead. Hey, EMT student, head to trauma bay number 1 for a cardiac arrest coming in 8 minutes. Okay? That's a great preceptor. If you don't have a great preceptor, and it could be as simple as a personality misalignment, feel free to look for another one. You're welcome to. You don't have to just have one. But you have to be proactive about it, right? There's more than one ER tech per 8-hour shift. So you're welcome to look for another preceptor. If you're doing a rotation right along at a fire department, a typical firefighter schedule is every 3 days. They work for 24 hours and they're off for 48. So if you're at this place for every 3 days for a few decades, this is your second home. You're eating with the same people, you're sitting in the same seats, you're sleeping in the same bed. So a quote that was passed down to us in paramedic school is, be the last person to sit and eat be the first person to jump in on chores. And so if you see someone doing dishes, setting the table, mopping the floors, cleaning the bathrooms, washing the ambulance, try to pitch in. And then when food is ready, or if you enjoy cooking, maybe help out with cooking, just pitch in, try to be helpful. Last bullet point is try to take a break. We've had students previously pass out during the clinical, and it's okay if you do. You couldn't be in a better place to pass out. But take a break in the sense of go grab some air because you're wearing an N95 for a prolonged period of time. Grab some food, water, take a break, right? And sometimes they pass out because they see a procedure or a level of an amount of blood that they're not used to, and that's fine too. Our instructors have mentioned IFT before, but there are some differences between IFT and municipality. When we call 911, we're getting a municipality, typically. There are some private ambulance companies that provide 911 services to their local townships or suburbs. The company in mind is called Buds Ambulance. But IFT, or interfacility transport companies, typically provide transport between facilities. So it could be hospital to hospital, maybe for insurance or reasons or level of care was not seen at the initial hospital. Maybe they're going from hospital discharge back home or to a nursing home. Maybe it's nursing home to dialysis, home to a doctor's appointment. What I'm trying to get at is do not expect to go lights and sirens on these ride-alongs. And to be honest, after the first 10 times, it causes more chaos than order. And so, the expectation is when you have lights and sirens for people in front of you to veer to the right, and most do, but occasionally some get, scatterbrained and frightened, and some might even cut you off while going lights and sirens. So respectfully decline if we had the option, right? And don't feel like, that you have to race to a hospital because there's nothing you can do. We are trying to bring the ER to the patient. That's what an ambulance is, right? So remember that. If you have a contact on Chicago Fire Department, you're welcome to reach out to that contact. And, in previous semesters, it has been well received that our student is allowed to do an observational ride along on Chicago Fire Department. We just don't have an established partnership. And those that end up not riding on a fire department, don't feel like you're missing out on too much. Most people that call 911 are not calling for life-threatening reasons. So although the call volume is there, when I say call volume, in a typical CFD ambulance might run 20, 25, sometimes 30 calls in 24 hours. That's a lot. A lot of those calls are BLS and non-life threatening. So, don't feel like you're missing out on too much. Like I said before, be thoughtful and mindful about which 3 patients you want to write up a PCR on in the ED. So survey the land, take a tour, and think about the 3 patients that you feel like you can write a complete narrative in PCR on. Sometimes your preceptors might even offer you access to the patient's EMR, which is short for electronic medical records, on their computer. At no point should you be on their computer. You shouldn't be there to just read off someone's chart with their allergies and medications and surgeries and demographic information. You shouldn't be doing that. You're doing a disservice to yourself, right? You should be getting your information straight from the patient, right? So go practice your interview skills and your physical assessments. On occasion, the last bullet point, on occasion, you might, do everything correctly, show up on time, show up early to your ambulance ride-alongs, but sometimes EMT providers or paramedics call off for a variety of reasons. And, they will do their best to find a substitute partner, and sometimes that doesn't happen. So you might wait an hour or 2 for maybe the next EMT crew to come in so you can hop on their rig. And just sometimes it's just so slow. A lot of companies are still experiencing shortages, so we're trying to minimize that this semester. Right? By the end, you're going to write a reflection paper. It says papers, but it's 1 paper, 3 pages, double spaced, and half should be reflecting on your experiences on the ambulance, and the other half should be reflecting on your experiences in the hospital. And I want you to talk about your expectations, the experiences that you learned, any formative moments, and how it has shaped your outlook on how you want to utilize your EMT license. Okay. Let me know if you have any questions. This is a private video. But email me with any questions. On the left, you see Katie, one of our former instructors. She currently works at Superior at the moment with a student of hers in the back. And then on the right, you see Diego and David, 2 of our instructors that took our students to Lollapalooza last summer. So typically, clinicals and ride-alongs are the most fun part of the EMT program. But at this point, you're probably feeling a mixed bag of excitement and anxiety and nervousness and fear. That's okay. One more thing I wanted to add is like, if you had the bandwidth in your schedule to spread out your clinicals, because as we proceed through the semester, especially with Unit 3, we're going to go into neurology and abdominal pain and immunology. And you're going to gain many more assessments under your belt. And it's going to open up many more patients that you can assess. Lots of patients come in with altered mental status or some level of confusion. Are they confused from hypoxia, head trauma, drugs or alcohol, seizure, stroke, diabetic emergencies, environmental emergencies? What is it? Right? That's a lot. Abdominal pain. Is it gastrointestinal, genitourinary, OB, GYN? Right? So if you had the bandwidth to spread out your clinicals, I highly recommend you do that. Please don't try to shove it in all within 2 weeks. All right. I know there's going to be a few of you that will wait till the last 2 weeks to submit your records. And we've had students that pass every exam with flying colors and just procrastinated on obtaining their records. And they would have passed, but they simply did not complete the course because they didn't do the clinicals. Don't be one of those. All right. Message me with any questions. See you in the next video, or I'll see you in class. Later.